Well, we could be on the verge of another weight loss craze. There's a new weight loss pill that studies show replicates the effects of gastric bypass surgery. It's called SINT 101, and it's a daily pill that boasts zero side effects. Joining us now to talk more, board-certified obesity medicine physician, Dr. Jessica Duncan. Great to see you.
Great to see you too. Good morning.
SINT 101, we're going to be hearing a lot about it. Almost sounds too good to be true, though. The makers of this experimental drug say it preserves lean muscle mass, too, better than these GLP-1 drugs that have been stealing headlines like Ozempic and Wegovy. Can you explain that more?
Absolutely. So yes, a lot remains to be seen with these medications, but the studies that we've seen so far look really promising. The original studies that were done in rodents showed that these animals had 0% lean muscle loss, which is very different than what we see with other weight loss medications and weight loss in general. But this first human study that they brought to the European Congress this week looked very promising in terms of safety and tolerability profile.
Interesting. So how can a pill mimic the same results of that massive medical procedure like gastric bypass? If you can explain how gastric bypass works as well and how this is different.
Absolutely. So the concept with gastric bypass is that that first portion of the small intestine is actually bypassed, meaning that food isn't digested there, but obviously it's done surgically. This pill has some really interesting technology. It actually forms a coating on the lining of that same portion of the intestine. So for the same reason, food is not digested there and it leads to weight loss, but it's a pill, a once daily pill that forms a polymer lining just on that one section of that portion of the small intestine.
All right. There are all sorts of side effects from Wegovy and Manjaro and Ozempic. I've got friends who are on some of the drugs. They say they feel so lethargic. Some of them, they can't even hardly get off the couch to go for a walk, which is obviously not good, but they are losing weight on them. The makers of this drug say there's zero side effects, but I'm also reading that they're in clinical trials. So I'm trying to square all of that. How can they say zero side effects if they're still in clinical trials?
Right. So remember, the study that they showed us this week was only in 9 humans that took 1 dose of the medication. So in that small group of people, they had no side effects, no serious or adverse events, and they didn't have any gastrointestinal side effects. But with 9 people, it's really hard to tell, and especially with just 1 dose of the medication. So the phase 1 clinical trials that'll come up next will tell us so much more about that safety profile.
Look, the Ozempic and Wegovy, all the GLP-1s, they've really disrupted the food industry, diet culture, fitness industry, all of that. I imagine this would do the same if it hits the market. When do you think this drug could hit the market if it does?
So they're going to go ahead and apply to start that phase 1 testing in 2025. So of course, a couple years down the road, but we will learn so much more as we get into that phase 1 trial.
All right, and we know that some of these GLP-1 drugs, they're very expensive, especially in this country. We had President Trump, while he was on his big trip, talking about the fat shot that his friend had, as he called it, and said it was so much less expensive in the UK than it was here. And we know that very often they're not covered under insurance for a lot of people. Any idea on a price point for SINT 101? Do we have that info?
No idea on a price point. I would imagine that it would probably be pretty expensive, just the way, normally we see that with these new drugs and technology hitting the market, but no idea yet on price point.
And as a doctor, can you just sort of underscore the importance of just eating right and exercise? I know it's not always that easy for everybody, but it can do the trick. Can you talk about that just as we go?
Absolutely. It is a huge, huge deal to make sure that we are kind of attacking obesity care from all angles, right? So medications are super helpful for correcting the biological causes of obesity, but you have to make those lifestyle changes as well. Diet and exercise are so important. And also when we were talking about lean muscle mass, right? That happens with weight loss, not just from medication, but, it's really important to continue to do strength training to try to prevent muscle loss, make sure you have great supplements and other really great nutritious foods are super important. It has to be a whole lifestyle change.
That skeletal and muscle mass really is an indicator of longevity for people. So we need to be putting it on rather than trying to get skinny. Dr. Jessica Duncan, thank you so much. This was a great interview. Appreciate it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.